Over the last 24 hours, we have identified 1,363 new cases of COVID-19 and completed about 4,986 tests. Our positivity rate for lab-confirmed cases is about 29.3%. Turning to hospitalizations, there are currently a total of 1,586 people with COVID-19 in hospital, including 126 in the ICU. Sadly, I must share that 22 new deaths were reported to Alberta Health over the last 24 hours. I send my sympathies to the family and friends grieving the loss of these Albertans. Their passing leaves a hole in their communities, as does the loss of anyone from any cause. As of February 10th, Alberta Education has advised only 4 of the more than 2,500 schools in Alberta are currently shifted to temporary at-home learning to address operational challenges. Alberta Education will continue to work with school authorities on shifts to at-home learning, and all requests from schools to shift to at-home learning so far have been approved. It is encouraging to see a continued declining trend. Less than 0.25% of schools are now on temporary at-home learning.
We have seen since January 16th a decline in cases. We've seen even that's that number so our wave in terms of community spread appears to have peaked about then, and that's backed up by wastewater data. And then for more than 2 weeks, we've actually seen new hospitalizations dropping like a rock, and that's so we know that the actual in hospitals is also going to follow that trend. And so and our approach generally is we try to manage this so that we put the measures in place that are required, because each the measures that we put in place, they have a cost. And they have a cost on impact on social activity. They have a cost on impact on economic activity. And so we try to put them in place when necessary, and then reduce them as soon as we are able. So given all these trends, we know that the numbers are going to come down. I fully appreciate, and once again, I thank all of our healthcare workers for the work that they are doing into supporting our system, but those numbers are going to come down. And so by making this move now, we are trying to reduce the impact and the negative impacts that these measures have. And I guess I'll make one other point. We went from the fourth wave with almost no changes in the healthcare measures straight into the fifth wave, and we actually increased them. And so we are mindful that there may be another wave. I am hopeful, based on all the conversations that Dr. Tam, for example, has indicated that we are likely moving into an endemic phase, but there's no guarantee of that. So, trying to limit the impact to the greatest extent on Albertans, and then, part of our job and the job that the Premier gave me as Minister of Health is to do contingency planning for whatever comes at us next. So, we're moving now because it's safe to do so, and we're trying to limit the negative impacts that these measures have on Albertans to the greatest extent possible. We took a look at our assessment of the REP, and as the Premier indicated earlier this week, but has also been discussed previously. The purpose of the REP, which was incredibly effective when we actually put it in place during the Delta wave, was to reduce transmission. It allow businesses to continue to operate. So either have be vaccinated with a QR code, or have a test to show that a negative test, and so businesses can continue to operate, and people be involved in going to restaurants and doing other entertainment venues, for example. What we've seen in terms of the data with Omicron, it is far more transmissible, and that the REP as currently structured with two doses, you're still seeing a large number of breakthrough cases. Some studies were showing with Pfizer with 2 doses, and this was in December, was ballpark 30% effective at reducing transmission. Although, just let's be very clear, vaccines have assisted us greatly through the Omicron wave. primarily for the reason that it helps protect against severe outcomes, in which we haven't seen a huge impact, although it's been challenging, but a huge impact on our healthcare system. So when we took a look at the original purpose of the REP was to reduce transmission, but given that vaccines, the 2 doses of vaccines were not very effective in terms of doing that, that's why we removed this. Because we didn't see the effectiveness. And also, as mentioned by the Premier, it creates some divisiveness within society. We need to start moving forward to learn to live with Omicron. We see the hospitalizations, new hospitalizations, has been coming down every day for the past 2 weeks. We've seen, we have a general trend line down in terms of hospitalizations, people actually in hospitals at this point in time. So we don't, it's time to move and reduce the measures. And then given the lack of effectiveness of the REP, that's why that was the first on our list to actually remove.